Hello, this will be a brief overview on blood flow restriction training. Blood flow restriction training has a few different names, but the results are very similar. And there can be different applications for it. It's not just for performance. Essentially, in blood flow restriction training, you are occluding the limb or both limbs, which causes fluid to be trapped and the compartmental space in the limb to expand and swell. This swelling triggers the skeletal muscle pressor reflex, which is probably the main reason why in all of the different types of protocols for blood flow restriction training, the outcome is very similar. The main differences in some of the protocols really is in the reps and the amount of rest between your sets. Kaatsu training has about 120 repetitions, and most other standard blood flow restriction training protocols are about 75 total repetitions. When starting a new exercise program or incorporating special protocols into an ongoing program, it is important to consult with a primary care physician or a clinical specialist in order to see if you are fit for the demands of the training protocol. BFR does have some contraindications and side effects. If you have more than one contraindication for BFR, it should only be used very cautiously. More than two, you're probably not going to want to use BFR on the person. There are also side effects with BFR, and that's different from person to person. I use BFR on myself, and sometimes I do get dizzy, more so when I use BFR on my legs. And I only really do maybe 2 exercises for my legs, and I can get kind of dizzy after I take the cuffs off my legs. Blood flow restriction training is applicable for several populations and is a viable option for the prevention of reperfusion injury during organ surgery. It is not clear whether BFR is beneficial for other surgeries outside of like organ surgery, either like rotator cuff or like meniscus or something, but there are studies that have shown a faster improvement time or recovery time with groups of people that did blood flow restriction training prior to the surgery and also post-surgery as well. At the cellular level, blood flow restriction training stimulates many pathways and responses. Some of them are anabolic in nature and some are catabolic. What is interesting is that how I mentioned before, blood flow restriction training mimics high intensity aerobic exercise. One of the biggest improvements is in like buffering rate of metabolic waste products. But what the interesting part is that the mitochondria not only improve their function in a high stress environment, but the number can increase as well, much like purely aerobic or endurance type training protocols are seen to do. The equipment used in blood flow restriction training can vary, but the straps are one of the most important pieces of equipment. A wider cuff will cause less discomfort and a less chance of nerve compression, but more pressure is required to reach the occlusion rate. I would normally, and I would suggest, would use a dynamic style with compartments of air pockets that are like individual bladders instead of like one single bladder in the cuff. That way the air and the pressure can be distributed rather equally, and it's a little bit easier to maintain the consistency or the same amount of pressure while the exercise is being conducted. For the application of BFR, it is extremely important to receive professional instruction of the equipment and exercise protocols in order to ensure the proper safety when administering blood flow restriction exercise sessions. This video isn't intended to make anyone an expert or certify anyone in blood flow restriction training. It's just to open or share knowledge of BFR and the benefits of using it in an exercise regimen. Here are two different examples of the application of blood flow restriction training. Passive swelling is also called remote ischemic preconditioning or just ischemic preconditioning, and you're not exercising or moving, you're just inflating the cuff and occluding the limb, and that's it, hence the name passive. In terms of performance, BFR can be inserted kind of anywhere. It just depends on how you want to use it. Anywhere in a periodized program before, kind of like pre-competition or a certain goal, or you're just trying to do recovery or something. And it just all depends on how you want to fit blood flow restriction training into your already ongoing training protocol. This wraps up the video on BFR training. I hope it was helpful and informative. If you have any questions, please leave them in the comments below, and thank you.